Welcome to my presentation. Now we can discuss the some anatomy and physiology MCQs from cardiovascular system. So here you can see the first question. The first question or MCQ. The first question. The layers of the heart are the following. The layers of the heart are the following except. The layers of the heart are the following except. The layers of the heart are the following except epicardium, myocardium, pericardium, endocardium. The layers of the heart are the following except epicardium, option 1, epicardium, pericardium, myocardium, and option D, endocardium. The answer is pericardium. Pericardium is not a layer of the heart. Epicardium, myocardium, and endocardium, these three are layers of the heart. The next question. Next question. Second question. In pulmonary circulation, the blood is pumped from. In pulmonary circulation, the blood is pumped from right atrium, option A, right atrium, right ventricle, left atrium, left ventricle. In pulmonary circulation, the blood is pumped from right atrium, right ventricle, left atrium, left ventricle. The answer is B, right ventricle. Then next one, right and left ventricles are externally separated by. Right and left ventricles are externally separated by interventricular septum, interventricular groove, auricular appendix, coronary sulcus. Right and left ventricle are externally separated by interventricular septum, interventricular groove, auricular appendix, coronary sulcus. The answer is B, interventricular groove. Then the anterior chambers of the heart are called. The anterior chambers of the heart are called. The anterior chambers of the heart are called ventricles, atria, sinus venosus, truncus arteriosus. The anterior chambers of heart are called ventricles, atria, sinus venosus, truncus arteriosus. The answer is D. Then next question, the posterior chambers of the heart are called. The posterior chambers of the heart are called sinus venosus, auricles, ventricles, truncus arteriosus. The anterior chambers of the heart are called atria. The posterior chambers of the heart are called sinus venosus, auricles, ventricles, truncus arteriosus. The answer is C, ventricles. The next question, internally both the ventricles are separated from each other. Internally both the ventricles are separated from each other by interventricular groove, interventricular septum, auriculoventricular septum, columnae carneae. Internally both the ventricles are separated from each other by internal ventricular groove, internal ventricular septum, auriculoventricular septum, columnae carneae. The answer is B, interventricular septum. The next question, the valve present at the right auriculoventricular opening is. The valve present at the right auriculoventricular opening is bicuspid valve, tricuspid valve, mitral valve, spiral valve. Bicuspid valve, tricuspid valve, mitral valve, spiral valve. The answer is B. Then systole of heart is. Systole of heart is relaxation, contraction, one contraction and one relaxation, two contractions and two relaxations. Relaxation, systole of heart is relaxation, contraction, one contraction and one relaxation, two contractions and two relaxations. The answer is B, contraction. Then diastole of the heart is relaxation, contraction, one contraction and one relaxation, two contractions and two relaxations. Diastole of the heart is relaxation, contraction, one contraction and one relaxation, two contraction and two relaxation. The answer is relaxation. Systole means contraction, diastole means relaxation. The next one, the volume of blood that is pumped out by each ventricle at each heartbeat is called. The volume of blood that is pumped out by each ventricle at each heartbeat is called cardiac output, stroke volume, cardiac cycle, tidal volume. Tidal volume, it is related to respiratory system. Cardiac cycle, stroke volume, cardiac output. The answer is stroke volume. So the normal stroke volume is 70 ml approximately. Okay, then next, the stroke volume of left ventricle in the heart of human being is 70 ml, 4900 ml, 500 ml, 250 ml. The answer is 70 ml. Then the tricuspid and bicuspid valves are closed due to. The tricuspid bicuspid valves are closed due to increased pressure in left ventricle, increased pressure in right ventricle, decreased pressure in both ventricles, increased pressure in both ventricles. Increased pressure in left ventricles, increased pressure in right ventricle, increased pressure in both ventricles, increased pressure in both ventricles. Sorry, decreased and increased. Tricuspid and bicuspid valves are closed due to. The answer is D. The next question, lup sound is produced due to. Lup, the heart sound, lup sound is produced due to opening of bicuspid and tricuspid valve, closing of bicuspid and tricuspid valve, opening of semilunar valve, closing of semilunar valve, opening of bicuspid and tricuspid valve, closing of bicuspid and tricuspid valve, opening of semilunar valve, closing of semilunar valves. The answer is B. The next question, the ventricles relax after. The ventricle relax after auricular systole, auricular diastole, ventricular diastole, ventricular systole. The ventricles relax after auricular systole, auricular diastole, ventricular systole. Option D, ventricular systole. Okay, the next question, dup sound is produced due to. Dup sound is produced due to opening of bicuspid and tricuspid valve, closing of bicuspid and tricuspid valve, opening of semilunar valve, closing of semilunar valve. Dup sound is produced due to opening of bicuspid and tricuspid valve, closing of bicuspid and tricuspid valve, opening of semilunar valve, closing of semilunar valves. The answer is D. Dup sound is the first sound of heartbeat, the second sound of heartbeat, the third sound of heartbeat, the fifth sound of heartbeat. The first sound of heartbeat, the second sound of heartbeat, the third sound of heartbeat, the fifth sound of heartbeat. The answer is B. Then semilunar valves get closed during. Semilunar valves get closed during auricular systole, auricular diastole, ventricular diastole, ventricular systole. The answer is C, ventricular diastole. Then the cardiac cycle lasts for about 0.6 seconds, 0.8 seconds, 0.1 second, 0.4 second. 0.8 second. Then complete cardiac diastole lasts for about 0.2 seconds, 0.4 seconds, 0.6 seconds, 0.8 seconds. The answer is 0.4 seconds. Then the volume of blood pumped out by heart from each ventricle per minute is called. The volume of blood pumped out by heart from each ventricle per minute is called cardiac output, stroke volume, auricular output, ventricular output. Ventricular output. The answer is cardiac output. Then volume of blood present in adult male is 5 liters, 7 liters, 10 liters, 3 liters. The answer is A. Venous return depends on the following factors except respiratory pump, muscle pump, gravity, blood pressure. The answer is blood pressure. Then increase of blood pressure without a demonstrable causes. Increase of blood pressure without demonstrable causes. Primary hypertension, secondary hypertension, orthostatic hypotension. The answer is increased blood without demonstrable cause. E is a primary hypertension, secondary hypertension, orthostatic hypotension. The answer is hypotension. Then blood pressure depends on the following except stroke volume, heart rate, peripheral resistance, D end. Blood pressure depends on following except stroke volume, heart rate, peripheral resistance, end. The answer is C, peripheral resistance. Then the first heart sound is heard best in. Mitral value, aortic value, pulmonary area, all of above areas. The answer is mitral value. At mitral value, the first heart sound we can hear best. Then alternation of heart rate in different phases of respiration is tachycardia, bradycardia, sinus arrhythmia, fibrillation. The answer is sinus arrhythmia. Alteration of heart rate in different phases of respiration is called sinus arrhythmia.